Dr. Greg Sadler is the president and co-founder of Reason.io, the editor of Stoicism Today, and the producer of Half-Hour Hegel series. He also teaches philosophy at the Milwaukee Institute of Art and Design. The title of Dr. Sadler's keynote speech is Complex Causality in Crises and Solidarity with the Vulnerable.
My talk today is going to be about complex causality in crises and solidarity with the vulnerable. And I think you might be able to see from the title of that where some of this is going. Before we jump into the talk, I'd like to extend my gratitude towards the conference committee for asking me to provide this presentation, and to the American University of Paris for hosting this event. And I'm very happy to be among a great set of other speakers. I'm looking forward to seeing many of the other presentations. So, long story short, when I was asked to give a talk for this, and it's about the psychology of global crises, it gave me the opportunity to discuss some matters that I've been thinking about for quite some time, but haven't completely thought through to the degree that I'd actually do writing about it. So what you're getting here is a bit of raw product, you might say, although it's hopefully had some refining done on it. And, as we've been living through this COVID-19 crisis all around the world in very different circumstances, it really has provoked a lot of thinking and discussions that might be helpful. And the idea of causality, which is something that is not unique to philosophy, but I think philosophy has some contributions to make, is one of the things that I want to focus on here. So the basic ideas of this talk are the following. Crises emerge out of highly complex causal interconnections and interactions, and at the same time, the human beings that are involved in these crises quite often want to go to rather simplistic views of the causality involved, and that continues the crisis and tends to worsen it. We don't actually have to understand a crisis fully in all of its causality in order to be able to do anything useful in the crisis, but we do need to approach things in a way that does some justice to the complexity. So when we understand causal interactions and connections and intersections and nexuses, then we have a certain intelligibility to what it is that we're trying to make sense of. And this is very important from ethical and leadership perspectives, because when we approach crises like the one that we're in with COVID-19, a lot of people want to get back to the normal. They want to get back to the status quo, how things were before. But one of the things that crises like this really bring out to us is the fact that the status quo wasn't working for so many people across the world, and the ones that we see within our own areas, communities, nations. So if we shift our focus to understanding things in, not necessarily the most complex ways, but more complex ways, that will also produce another shift. That will allow us to focus on something that we can call the common good. Even more importantly, it allows us to shift focus to those who are more complexly impacted by the crisis, those who are, for a variety of reasons, more vulnerable, which is where we should be directing focus on the part of others and pointing our own focus as people who might have something to do in this crisis. So there are a lot of implications, I think, for ethical decision-making and evaluation, and there are also implications for solidarity and leadership. So That's what I'll be talking about. I hope we have a lively discussion coming out of this. Again, this is sort of a work in progress, and I won't claim to have everything perfectly well, defined or worked out entirely, but I hope this can promote some good discussion in the session. One of the key terms in the title of this talk is causality. And what do we mean by causality? Well, this is something that we talk about quite a bit in philosophy, but it's central to other discourses, and indeed we can't get away from it in our ordinary life. It's something very central to human ways of approaching the world. And so much so that Immanuel Kant, the great, German philosopher, thought that causality was one of the basic categories through which we understand the world. David Hume, the person he's reacting to, said that we can't actually observe cause and effect, but also thought we couldn't get away from it. And there's much more that could be said about all of the ins and outs of the history of this concept. Causality provides us with answers to the question why. Why are things the way they are? Why did they turn out the way they did? Why did this happen? Why didn't this happen? Why am I getting sick? Why did somebody have to die? Why can't we fix what's going on here? Those are all things that can be answered by thinking about causality. And as we explore the causality of things, we obtain a certain intelligibility. Another way of talking about that is we understand things better as we explore and investigate causal connections and matrices. And real things, the stuff that we experience in our life, the things that we are going to be talking about forever and acting upon, are typically complex themselves, and they're caught up within complex causal matrices in which there isn't a nice, simple picture of things. There are some things, I can turn on a light and, the electricity flows to it and the light goes on and now I see it and the room is illuminated. But most things don't work in quite such a simple way. At the same time, we human beings have a tendency to want rather simple causal explanations for things and to prefer them and to talk about them quite a bit. I should also point out, too, that we human beings complicate things quite a bit because we are also causal agents. And we not only act, we interpret causality and make decisions on what we think to be its basis and advise each other. We engage in deliberation. So on the one hand, we have simplicity is something that we often desire, sometimes to our detriment and to the detriment of others. On the other hand, we have complexity. The contrast that I want to talk about here in terms of complex and simplistic causality is not the same thing as simple and complex causality. Simple causality would be there's some sort of causal process and it can actually be described in simple terms because it actually is simple. And the vast causal networks that we're part of are composed of much smaller, simpler parts, which may in fact connect with each other, but could be isolated out from each other as well. If not, we couldn't ever fix anything. But we also have our explanations and our interpretations of things. Those can be simplistic, that is, too simple, being presented in a way that doesn't do adequate justice to what it is that we're trying to investigate. So, frequently the things that we are experiencing and discussing and deliberating and choosing and acting on, they involve complex interactions and connections. So this tendency towards oversimplification is a problem precisely because in doing so we are making things too simple. I'm not saying, by the way, that we always need to understand causal nexuses and connections in their absolute fullness in order to, understand everything. This is sort of a relative distinction. So when we're thinking, for example, in this time of COVID-19, about people who are talking about the need to reopen the economy. Why? Because reopening the economy will prevent a currently existing harm, which is people being out of work and not being able to get food and eat. That's an example of oversimplistic understandings of causal factors and matrices. The economy by itself, I mean, it wasn't actually closed. If it was, then we wouldn't have any economic activity going on, right? But the economy is an incredibly vast thing with all of these different things going on within it. And what we're talking about doing, when people bring up this term is, changing this thing, changing this thing, changing this thing. And notice the changes that are being made are typically policies or laws or injunctions that are happening. It's not like we're turning on a spigot or a light switch or anything like that. But people are often presenting things like that. And that causes some issues for us. So, we're in a crisis. We might think of some other examples of oversimplistic ways of looking at what's going on. Some people pointing out that masks are not 100% effective or treating masking as if it's a panacea for the COVID crisis, or, claiming that the motivations for having masks or engaging in social distancing or quarantines or shutdowns are these simple things that we can identify, like people are just afraid, they're overreacting. Well, there's a causal explanation being provided there, but it's not an adequate one. Others who are focused on the origins of the virus and spending a lot of time emphasizing how it's the Chinese virus or the Wuhan virus. Arguably that's some oversimplistic causal thinking as well about what's going on. Expecting quick fixes for any of this sort of stuff, I would say, is oversimplistic thinking. And so what's going on there? Why is this a problem? I mean, can't we just let people say and think whatever they like? Yeah, well, they will, but here's where the problem arises. It's not just a failure to grasp some of the complexity of the current pandemic crisis. It's a failure to see interconnections between this crisis and other crises and problems. And along with that, this insistence on oversimplistic views or schemas or dynamics and conflicts or narratives that presents the big problem. Now, why is that the case? If we think about how causality and crises fit together, we can say that a crisis occurs because of some things that we can identify as a cause or causes, and we might give them sort of a capital C, right? This is a crisis because of COVID-19, the virus and the way in which it spreads and acts and the deaths and other harms that it's producing. But these sort of causes rarely determine matters entirely on their own. There have to be a lot of other things going on at the same time that are contributing, playing some role, making things worse, removing obstacles that would stand in the way of, say, the virus, or, if we think about environmental catastrophes, some of the things that would prevent that from happening. And so by investigating and taking into account and trying to grasp more of causality, we understand things better. And we also then are able to take into account human factors, the views, the actions, dynamics of other people. And the more that we understand, the more that we see that, at least in some crises, I won't say this necessarily for all, but at least in some, before the crisis happens, things are not actually okay, although many people are telling themselves that things are okay. There's already going to be some long-standing problems. Some people, often those who are in privileged positions because of power or wealth or status or other things that place them at an advantage, are much more insulated from what we might call the understructure of the crisis. And so for them, it can seem like something totally out of the blue. Wow, this thing happened, and look how bad things have suddenly gotten. For other people, they can say, no, this is a bad thing, but other bad things have been happening, and now these are actually going to intersect with each other. So those who are worse off, those who are disadvantaged, those who are impacted by generational or community challenges of different sorts, or those who know, interact with, or support those, they tend to experience more of the crisis. Sometimes they're going to have additional insight into what's going on in the crisis, and they're often going to be much more challenged by it at the same time, particularly in their ability to communicate with others what's happening in the crisis, and this tends to lead to worsening. Before we talk more specifically about the COVID-19 epidemic that we're experiencing worldwide right now and the need for looking at complex causality so that we can focus on solidarity with the most vulnerable, I'd like to look at another example that you may be less familiar with, and that has to do with really like over the last, say, 2 decades, what's been happening in southern Indiana. And what we can see happening there is what we call not a pandemic or an epidemic, but a syndemic. Syndemic means that you have several different things coming together at the same time. That's the syn part of it. The term was coined by the researcher Merrill Singer in the mid-90s and originally was used in a purely medical context. And what it meant was that there's a synergistic epidemic, meaning that different factors would reinforce each other. It's not just the same thing as what we call comorbidity, which is more in terms of individuals. This has to do with communities. And fairly early on, they started to realize that if we want to think in terms of syndemics, we also need to think about non-biological factors. And so in southern Indiana, they were having a drug addiction crisis, and they also had an AIDS HIV crisis, and the two of them reinforced each other, in part because of using needles and, not washing them, and, the two things kind of went together. There was also a lot of mismanagement by the state, under the governor's regime. And they realized, looking at what was happening in some of these towns, where everything sort of broke down and people had really bad, tragic, often fatal outcomes, and then looking at other towns where this wasn't happening, that it wasn't just drug addiction and it wasn't just HIV and AIDS. There were other major factors that were playing a role, other plagues, you could say. So among these were violence, victimization, and crime, policing and prisons, job loss, less opportunities, the jobs that were there being more exploitative jobs, more demoralizing jobs, a lot of other economic issues, generational poverty, foreclosures, homelessness, a number of different health issues like diet and food deserts, also diabetes and health disparities, and of course a lot of mental illness and depression and despair. You put these things together in a sort of, again, complex way, and working at one factor by itself doesn't tend to produce a lot of results. Why? Because the others end up reinforcing it. So it's almost, they described it as a game of whack-a-mole. You try to fix one thing, and you get some temporary fix, and then the other things rear their head and make it, people fall back into their old modes of behavior. And so policies or studies that we do often focus just on one factor. If we want to do something about these sorts of seemingly intractable situations, we need to approach them in messy, broad spectrum, complex ways that do justice to the causality that's involved there. So we have to add in other human-caused disadvantages as well. We have to think about, does racism or sexism or class or region or other factors, do those have a bearing upon this? We also want to think in economic and policy terms. Does having an austerity sort of mindset that we often call neoliberalism or late capitalism, is that impacting this in even more problematic ways? We might think of people's legal status, particularly since that has become so politicized here in the United States and caught up with these other complex systems like policing. We also might think about, bad government, where corruption turns out to take a lot of the resources away from the people that they're intended to help and direct them towards a political class and their preferred recipients. And another key aspect is the lack or loss of community, the breakdown of families, but also of neighborhoods, of towns, and the loss of connections, and to some degree loss of meaning. All of this happened in the crises that were happening in southern Indiana and tended to produce areas, not just single people, but areas where crisis became the normal state. And we can see this in many other places as well. Prime example of that is here in Milwaukee, one of the most segregated large cities in the United States, where we have incredible disparities in wealth, education, health outcomes, and things along those lines. So now when we turn to the COVID crisis itself, we have an international virus threat, which was not taken seriously enough by many, not enough to prevent it from getting much worse. It's in some respects surprising that we haven't had it even worse so far, and it's got a significant rate of infection and transmission, all sorts of serious, deadly effects that are coming as a surprise to us. All these other things that it turns out the virus can do to people. And at this point, we have no real effective treatment or vaccine. So it turned into a massive health crisis on its own and quickly led to additional crises. So this is where we are in the present. What are these other crises? I'm just going to mention a few, and we can talk about more in the Q&A and discussion part. So one of these is economic, and I think we could actually see this as a number of different crises, right? There was the need to close down a lot of places and shift to working at home, if that's even feasible. Many people have been laid off, and that introduced all sorts of other stresses into the systems. Many small businesses were placed in rather precarious situations, restaurants in particular, which are always a difficult business to keep afloat. Renters were finding themselves unable to make their rent, and landlords would tell them, no, I'm not going to give you any sort of relief. Landlords themselves are having problems because they are often quite leveraged. Another aspect of this are the what we call the essential workers, people who are being put at risk to earn their living. Some of them being coerced into this, being told that if they don't, show up and do things in dangerous circumstances, they will not only lose their job, they'll also lose the capacity to get unemployment and all sorts of other things as well. If this isn't happening in the part of the world where you're seeing the COVID crisis play out, rest assured, it is happening here in America in many places. And we have education crises. We had to send all of these children home. So K through 12 education suddenly had to go online for educators who were, for the most part, not prepared to engage in online teaching. Colleges and universities are in a similar boat, although they had some classes already online. We can also talk about crises of public spaces and of public transportation. We can talk about crises emerging in some political systems where, the The response of the government to the crisis is undermining the legitimacy of those governments. And we have a massive problem, particularly here in America, with prisons where these are hotbeds of infection. Many people who are there in jails, for example, who haven't actually been convicted of a crime, are getting sick in Cook County or Rikers or so many other places. Policing, courts, all of those things have been impacted as well. And the discourses that are dominating the news and opinion formers and social media tend to look at things in rather simplistic ways. This can often lead to inaction or the wrong sorts of actions, and it leads to the perpetuation of misinformation, what we might call foolish narratives and suggestions and mishandlings of the crisis that we're facing. There are some additional problems here in the United States. America is unfortunately exceptional in these ways. One thing that we can talk about is the governmental responses have not been particularly good by contrast to some of those other countries. The Trump administration, Congress, they've passed some stimulus bills. Those were subject to all sorts of political shenanigans and wrangling, and we've already seen that some of the money was misappropriated. There hasn't been any coordinated response in terms of public health. Important agencies, once the Trump administration took over from the Obama administration, that would have helped out, were disbanded or defunded or ignored. So we were at a disadvantage already. But we've got some other serious problems as well that I think are less easily understood by people looking at it from the outside. And one of these is the fact that our system, if you want to call it that, is so federal and localized. States and local municipalities get to decide a lot of the responses to public health crises and economic crises. So we're very, very dependent on the leadership of those people in charge and their ethics, which are oftentimes quite lacking. And things can also be sidelined by factionalism. Here in my home state of Wisconsin, we've seen a stay-at-home order that the governor, acting appropriately, put in place. We saw that rescinded by the Republicans suing and going to the Wisconsin Supreme Court, dominated by pretty hard right Republicans who said some astonishing things during their decisions. And in large parts of the state, we no longer have any sort of effective control for spreading the virus because of this. Another thing that's often overlooked, because of our federalism and localism, there is no system to so many important things. There's no single education system. We do have a Department of Education, but they determine very little. Instead, we have this incredible patchwork of school districts, each of which may be doing its own thing, and states telling everybody in the state they have to do this thing, and sometimes being listened to, sometimes not. Same thing with the colleges and universities. Here in Milwaukee, we have a number of different colleges and universities, all of which are starting and ending on different dates, some of which are planning on being online in the fall, some of whom have already decided they're going to face-to-face. There is no system again. We have no single criminal justice or policing or prison system. Instead, again, a gigantic patchwork of interconnected but often not functionally working together systems. So what happens in one county may be very different from another county. We have no effective public health system nationwide either. Instead, we have, people relying on insurance that their jobs provide them with, or what's available on the Affordable Care act marketplaces state by state, or relying on Medicaid or Medicare, sometimes funded, sometimes not. Many people with no insurance at all. We have a lot of people who go into debt and bankruptcy because of their medical costs, and we have many people who stay away from hospitals because of that. Doctors here spend less time with their patients than they actually do handling paperwork. Our hospitals and insurance companies are often not motivated particularly by public good, but by profit. And we have entire hospital groups that are owned by venture capitalists. So this is a real problem here in the United States. The COVID epidemic has introduced, crises within our framework that are in some respect more problematic because the causality is more complex than in other places where there's a better coordinated response. So what are the results of this? Well, when it comes to vulnerable communities and populations, this sort of crisis and the fact that there's a complex causality to it makes them even more vulnerable in many respects and in complex ways that because they're complex, we would have to engage in some discussion, some investigation, some examination in order to make sense out of it. At the very same time, privileged groups and populations often are engaging in denying some really basic facts, engaging in calls to reopen a rather mythical notion of the economy, saying that that's where the real crisis lies. We have others who are stressing their own personal rights and freedoms, engaging in protests, refusing to wear masks, calling that tyranny, some of them coming in armed, a lot of non-compliance as well. When I take walks around here, I'm sometimes the only person wearing a mask in downtown Milwaukee. And so, what's going on? The dangers, the harms, the risks, they exist. And the privileged might be affected by it. So, every once in a while we see something that looks like a bit of poetic justice where somebody who is denying that there was a crisis and saying that they would keep their business open and they'd never wear a mask and they protest, they get sick. That does happen to quite a few people. But for the more vulnerable people, the risks, the dangers, the harms are greatly compounded. And we can talk about this in demographic forms. I mentioned that here in Milwaukee, we're one of the most segregated cities in the United States. Here in the city of Milwaukee, the bulk of the COVID-19 cases and deaths were in the African American community. That's changing now as the disease, is reaching a broader spectrum of people. I think that one of the things that we need to stress when it comes to those who are vulnerable is that while many people think that we just need to return to normalcy, in reality, things were not okay before the crisis, and things are not going to be okay after the crisis unless some significant changes are made. So those who want to return to an okay status quo are treating things in a very simplistic way. Really what they want to do is to keep their positions. Some are trying to, make even more money or exploit the crisis. And this comes, if we want to think about this in an ethical perspective, by being interested in themselves or others like themselves and not being interested in the others, the vast, majority of people who are going to be negatively impacted by it. And these typically go along with rather simplistic views on causality about what the crisis is and how to fix it, how things aren't connected to each other that actually are connected, who is impacted and how they're impacted. There's a tendency to write off people who are impacted, and also a tendency to say, well, they knew what they were getting themselves into, or they're getting paid for that, or things along those lines. The opposite of solidarity. Now, I'm not suggesting that we need to have some sort of radical or revolutionary measures at this point in time. Things are already bad enough, and we probably don't have the consensus to do much of that, at least here in the United States. But what I am suggesting in terms of ethics and in terms of leadership is that we really ought to be directing the focus to two main concerns. One would be for some sort of genuine common good or common goods. The other would be to the people who are most vulnerable or even just more vulnerable. And that means thinking about the why. Why are these people more at risk than others? Why do they die at a higher rate? Why do they have a harder time getting access to medical care? Why are other things impinging on them? Why, for example, are people who are being honored as heroes also being shot by police officers? We could go into many of these sorts of things. So I think that, here's my basic point, solidarity with the vulnerable is going to require that we take non-simplistic approaches and views, and we also keep common goods in view. It's not enough just to say, well, we need to look to the common good. We also need to investigate and think about and advocate for and make actions and engage in public deliberation about how these people and these people and these people are impacted, often in different ways, but in ways that place them at greater risk and cause greater harm for them. Crises possess ethical implications and dimensions, and those run throughout the entirety of those. I'm not going to try to provide you here with some sort of overarching theory of ethics and crises or, go into moral theory in any great depth. I'm just going to say a few things, and we can talk about this more in the discussion. So, two things right off the bat. I've mentioned so far that we need to be attentive to the common good, and we need to be in solidarity with those who are vulnerable. And I'm not going to talk much more about the common good in the ethics portion of this, in part because I want to keep things short, but also because I think we can talk about that more in our discussion. Suffice it to say that the common good and attentiveness and solidarity with the vulnerable are not going to be at odds with each other in any well-understood way of articulating these. And when it comes to moral theories, whether it's virtue ethics, ethics of care, deontological ethics, various, properly understood religious ethics, even utilitarianism, if they're actually well understood and applied in the right way, we are going to see all of these stressing the need to take care of those who are most vulnerable. The only exception to that would be ethics that are, primarily self-centered, whether they be straight-out egoism or the kind of, libertarianism that places an exclusive stress on my rights as opposed to everybody else's rights. But other moral theories are, again, rightly understood, going to focus on those who are vulnerable. So what does solidarity mean? I think that without, again, getting into great detail about this, we can say that there are a number of different aspects, each of which is a set of obligations to be concerned and care and act. And so action is one of the primary things that we can talk about. We have a duty to act in such a way as to try to help those who are, and we might say to shield or protect those who are most vulnerable. And we can talk about this in positive ways and in negative ways. The negative ways being trying to ward off evils that are going to happen to them. But we can also talk about helping people out and doing positive actions, which might sometimes just be transferring some money, but oftentimes may include all sorts of other things as well. So we want to be prudent in how we're, acting, and we want to do so in such ways that will help out those who are under the greatest stress, those who are risking harm not just from COVID-19, but from perhaps losing their place of residence or in trouble for other things, So that's one key aspect. Another, I would say, is a duty to advocate for. Very often, those who are most vulnerable are also the least listened to. So without trying to, make ourselves the objects of attention, we can use the fact that we often do have more privileged positions, that we're listened to more often, to speak for others, to try to advocate for them as best as we can. And I think we also, if we want to talk about complex causality, we really do have an obligation to try as best we can to understand the conditions of others and why some people are at much greater risk and disadvantage than others, and why simple solutions are often going to negatively impact them because of things that people didn't think about, or leave them behind. We also, I would say, have an obligation going along with that to call out and criticize those who are mistreating the vulnerable, those who are exploiting them, those who are doing things that actually accentuate or perpetuate the harms against them. And all of this can be done in many different ways, and we have many different opportunities for engaging in this. I'm not going to get more specific than this at this point in time, but what I will highlight is that if we do understand these crises in complex ways that do justice, at least to some degree, with the many different ways in which causality is taking place, we see those people caught up within those frameworks, and we can see that's where the priority really ought to be. To bring this to a close, the last thing that I want to mention is leadership. And I would say that in this crisis, what we've seen is quite a few people who are leaders in name are not genuine leaders because they're lacking in some of the key dimensions of leadership. And I'll lay them out for you very quickly here. So crises do, in fact, require leadership for coordination, for having some sort of, response that can ward off harms and help produce better outcomes. So one key aspect of leadership is actual decision making. And many of the decisions that genuine leaders have to make are quite difficult decisions. They have to weigh a number of different bad outcomes against each other and choose between them. And they have to take responsibility for it, full responsibility. They can't push it off onto others. They have to be willing to accept that. Another key thing that leaders have to be able to do is to communicate effectively to the public, to those who they are making decisions decisions that are going to affect all of these people, the community at large. And they also have to be able to try to communicate even with people who are opposed to them, to try to get them on the same page. They may not be totally successful with that. There's two other dimensions of leadership, and this goes to, the title of this paper that I think are absolutely essential here as well. One of them, and this is where many people are failing in leadership right now, is that there's a duty to be informed, to actually know what they're talking about, to seek out information, to seek out experts, to seek out those who have experiential expertise and understand how things are happening on the ground. Without this, there's no real leadership. It's just flailing around in a blind way or following ideology or, providing rationalizations rather than, practical reasoning for what one wants to do. The other thing is leadership must be ethical or it's not genuine leadership. I've mentioned already that the common good is something that leaders need to start paying more attention to, and some leaders have. But I think that this aspect of the focusing on the most vulnerable and solidarity with them is really quite key. And I'll use the example of essential workers. We do have many people who are essential workers. They don't have to be called heroes. They don't actually need people clapping for them. They certainly don't need airplanes flying over it to honor them. What they need is more PPE and, better conditions, and making sure that when they're coming home from, putting themselves at risk, that they're not at risk because of other things like policing or bankruptcy or all sorts of, other complex causal factors. So a genuine leader in this situation would be somebody who would look at this crisis in a way that sees the complexity of the causality, and that would lead them to seeing the need for solidarity with the most vulnerable.